Let's just have fun. Let's get ready to rumble. Hello and welcome to, I believe, a double-digit session of SIH's Town Halls. Good morning, good afternoon, whenever you see this. My name is Carrie Burchell and I'm the Director of Organizational Development and the lucky person to facilitate today's work together. Our goal behind starting these town halls, like I say, about 10 versions ago or 10 sessions ago, is to really help everyone get the same message from our leaders to understand what our true north is and to have a spot where anyone in the system can answer questions, get questions answered, and you can submit your questions on the hub. We look at those. You'll find that we may not be answering verbatim what your question specifically was. Tracy Heron is fantastic in the background. She looks at all of the questions and helps thematize them so we can answer general themes. If your question is really specific to your department, then we do fuel those back to the department leaders because we want this time to be information that is relevant and applicable to everybody at SIH. So without further ado, we're going to start off with Bart Milstead, who is our Chief Operating Officer. Bart?
Hey, thank you, Carrie. As we normally do, I want to start off our virtual town hall with some really good news, some really neat things that are happening around the health system. And today I get to start off with some really neat stuff that our staff are doing for our patients, the above and beyond stuff, the stuff that makes us special, the stuff that makes us SIH. So the first shout out is to Heron Hospital. They had an ICU patient over there for about 17 days. And one of the screeners over there, Cecilia Day, kind of developed a relationship with the family as they kept coming and going to see their mother. And one day that she found out that the family was hearing that their loved one was going to have to be put on hospice. And so without saying a word, Cecilia went to the gift shop there at Heron, which is now open, which is a great thing, and bought a little angel, right? And had it sent up to the family's room. And the family was just super touched. And it means a lot. Those are the kind of things that when we go above and beyond really make a difference for our patients, how they feel about their stay. Another one, we had a cancer patient that called the Cancer Institute distraught because someone had stolen their medicine off their porch. Yeah, I mean, yeah, just
Who
really
does
crazy
that?
stuff. And it was caught on camera, so they know who stole it, but they still don't, they didn't have the medicine yet. So the practice called the medical sales rep in Tennessee, and they came up with a plan, and the sales rep actually helped us out and drove the medication up here to the Cancer Institute for this patient. So another just shout out to just great things that happen within our organization from our outstanding staff. We've given out multiple Daisy Awards. I don't know if John is going to maybe talk about some of that later. Those are unique events that are so awesome to share in with everybody in the system. And then the last thing I'll kind of go over with you, Carrie, is this Our Shot. Spread the word. Marketing, communications, and community benefits have done a really great job with individuals across Southern Illinois to get the word out about Our Shot and getting vaccinated. So if everybody has an opportunity, please visit OurShotSI.com to see more of those great stories. I think it should take advantage of that. It's really neat stuff.
Yeah, but it's exciting to see the influence that Southern Illinois healthcare has in the region. I know we have a lot of questions ahead, so I'm not sure if John is going to have a chance to really highlight some of those Daisy Awards. So be sure to look at where those things are posted in your hospital systems to really celebrate our colleagues at SIH for doing that kind of good work, Bart, that you've highlighted. Thank you.
Mhm.
I'm going to jump in. I'm super excited today. I think of SIH being led by all of us. We all have a role in leading the charge of our patient experience. And we have two directors today instead of a panel of senior leaders, which I love. Jonna Smith is our nurse executive at St. Joe's, and Molly Hamilton is our HR director of talent management. And they're going to field the bulk of questions today. So we're going to move into a broad theme, which was really around staffing. I wonder, Bart, if you can tee us up first by giving us just a broad overview of what staffing is like in healthcare nationally, what were the trends at SIH, just kind of cue us up so that we can get into more detail with our two directors.
Yeah, thank you, Carrie. I get another opportunity to update folks. As you know, going through the pandemic, we have seen a lot of people exiting healthcare. We've seen that we have a vacancy rate that continues to be higher than normal across our system. And this is something that we see nationally, though. I've spoken with other CEOs and their other regions of the country, and they're seeing some significant nurse vacancy rates. We are as well to some extent, but there's a lot of things we're focused on to try and improve that as we try and retain talent and recruit talent. And we're really focused on that. That's part of our X matrix this year is how do we continue to focus and strive to maintain staffing levels that we need. And I think the other piece of that is that we've become such a large piece of Southern Illinois as far as what we're capable of doing in the different service lines that sometimes it takes time and we have to train people. And, you know, I think all in all, we're above the curve with others in nationally, but I think, it's tight. And I appreciate everybody I know there's a lot of people that are working overtime and really helping us out in staffing areas. So I just say thanks.
Yeah, this interesting part that you say that we're maybe ahead of the curve because some of the questions that we got around staffing really have us concerned about staffing. So I want to highlight a lot of great processes and collaboration that are in place. Starting off with Jonna, can you tell us specifically about staffing and nursing? Because I know there's just some good work to open as many beds as we can.
Yeah, absolutely. Thanks, Carrie. So we do have several things currently in place. So back in December, at the peak of COVID, we implemented system-wide floating for nursing across the system. This is still our practice. So staff are floating to the other facilities if there's a need that's identified and they are not needed in their own facility. So we continue to do that and look at that every day. We have been very blessed that we have been able to secure several agency contracts, and we continue to work with bringing more agency into the organization. Mindy Piercy, who's our manager of our float pool and our staffing office, every week she works diligently on this. She works with our manager, she works with the outside agency to help fill those needs. Kudos to our staff. The agency nurses have been very complimentary of our organization and our teams here at SIH. And this is great news because if they feel like they're part of our team, then if we need them to sign an additional contract, they're signing on with us for additional time. So that really helps us out.
You know, Jonna, I love that you brought up the agency. We certainly have really tried to stay away from leaning on agency so much. And even with our fiscal goals, recognizing that, there's time when we need to spend money and we are doing that in the right places. So that's cool. And certainly Mindy and her team just do extraordinary work during COVID.
Yes,
It's been a challenge.
absolutely.
Yeah.
Another practice that we've had this going on for quite a long time is as a system, we do 3 system staffing calls. We do that at 10 a.m., 4:30 p.m., and 4:30 a.m. So our house supervisors, our staffing office, our managers, the nurse execs, we all participate in this call to really understand our staffing needs across the system, and we work to deploy resources to the location where staff are needed.
Wow. 3 calls a day. I'm just imagining like people in your house that either hear the phone ring or you jump on a call or you're taking a 4:30 in the morning call as you're laying in bed with your spouse there. That's great commitment to the organization. Thank you.
Absolutely. It's definitely a top priority for us. Again, we are very blessed that we have a critical bonus pay. So this is still active, but we have changed our process around it. So we are sending out these needs further in advance to allow our staff more notice to understand what our needs are. And then it also allows our managers further in advance to see what staff that they have for the upcoming week. So it's a little bit different than when we first implemented, but it's allowing us to have to be a little bit further along in the process than trying to do it week by week in the
Yeah.
same week.
So just making sure I understand that from the non-clinical lens that I have.
Sure.
If in all of those calls and Mindy's work and identification of the acuity or the sickness level of our patients, we will have areas where we critically need nurses. And if as a nurse I volunteer to take on extra shifts, then I get sort of critical a little bit extra pay, critical pay.
That's correct. It's for our nurses and our PCTs at this time.
Okay.
So we review that every 2 weeks to see if we need to continue that critical bonus pay. And I think we all know that right now it definitely is a need in our organization.
Yeah. Gosh, thank you for all of that work. Like I know you're representing the big nursing field in general, talking about that. So
Right.
thanks,
Yeah,
Jen.
absolutely. One other practice that we have, Mindy Piercy and Katie Album take a system look at our staffing for the next week. So they start to do this in the middle of the week, and they begin pre-assigning our agency nurses and our float pool nurses. Again, one more avenue for our nurse managers to really understand what needs they truly have for the upcoming week. So they're able to see their staffing a little bit further in advance and know what true needs they have coming up, so they can either have conversations with their staff if they're still in need, or if they need to balance their schedules a little bit differently. So just trying to be a little bit more proactive with that. Following that, every Thursday, Mindy, Katie, the nurse execs, Jen Throgmorton, myself, Samantha Melvin, and Jen Hari, our CNO, we meet and we review our staffing for the system. So we're able to see the big picture of what needs we still have out there. And during that time, we also look to see if we can open up additional beds based on our staffing and our nursing units for the next week.
Fantastic. I love that word you said, proactive. It's like COVID's gotten to a place where we're not as reactive and we can sort of get in this more proactive space. And so that helps everybody just plan their lives around what's needed and kind of the trends. So thanks, Jonna. That's a lot of
Absolutely.
great information.
Yep.
All right. So we've covered a lot of detail in nursing. That's doesn't cover some of the other areas of the organization that are just as vital to caring for our patients. So in the HR world, I'm going to put Molly on the hot seat for a little bit. We've done some changes in the recruitment process to really try to make sure that we get the right people in place, use our specialists in the HR office, those recruiters, to really use their talents and take away some of the work from managers so that the managers can lead and the recruiters can recruit. Can you tell us, Molly, a bit more about that process and what's happening, please? And maybe the mute button. Shoot. Mute button, Molly. Darn it.
Thank you, Carrie. Sorry for that. I
No
should have
worries.
known I would do that.
No worries.
Thank you for that question. So it does take time to learn new processes. Our recruiters are diligently working every day to present managers with qualified candidates. So it may seem like the process has slowed down. This is because managers are normally used to getting a long list of applicants, and they sort through them. They want to see who meets the qualifications, and they select those who they'd like to interview. But now our recruiters are doing a lot of that work for the managers to help them. So when a manager sees a candidate, they know that the candidate has already been pre-screened and is a solid candidate. So in the long run, it'll make the process more efficient and much faster. It's also important to note that the applicant pool for all employers is much smaller than it used to be prior to COVID. And Bart can introduce that concept to us, that there is just a staffing shortage nationwide. So we're seeing that here in Southern Illinois as well. So almost every business that you come across has Help Wanted signs in their windows. And that competition for our employees is just making the recruiting and hiring more challenging than it used to be.
The car wash this morning driving in on 13 was hiring, like, and I think there's a story in our head as an organization of like, why can't we get more people? It's not an SIH thing. We're actually, as Bart said, above the curve. I was on a call yesterday with other OD people in healthcare, and they're struggling. I mean, nationally, this is a struggle. It's not an SIH struggle, it's a national struggle. So we'd be wise to encourage our friends and family to come and work with SIH. You're all good people, and you have friends that are good people, and we want to fill the hospitals full of good people working with us. So really think about bringing in, your friends and family to do some of the work that we're doing. One of the questions that we're not going to get into detail about was the minimum wage, and we're not going to cover it because we went into a lot of detail last month. So that some of that repetition is partly because maybe people didn't see last month's town hall, or maybe we didn't really love the answer. We want to be transparent and upfront with you, knowing that we don't get to have our cake and eat it either. It's just a precarious time in economy and healthcare, and so look at the last one for how we are ahead of the curve, meeting the minimum wage requirements like years ahead compared to Illinois. And still, not everyone's going to get a raise, and that's explained in the last one. So I'm not going to go into more detail on that. I want to jump back to Jonna. around the Illinois Phase 5 mitigations and what that means to us in our in-person meetings?
Yeah, so I think there's been some great information shared in our daily update regarding in-person meetings. So I just encourage everybody to go out and take a look at that. I know our incident command looks at this consistently, probably on a weekly basis, and Bart can probably speak to that. I think we all want to be back in an in-person meeting. We want that human connection. So there are some expectations around in-person meetings and what it's going to take for us as an organization to get there, but that's all been shared in the daily update.
Okay, perfect. It is a little bit on us as audience members of this to look at the town halls, read the communication, all that kind of stuff. So the in-person meetings is likely impacted by vaccinations. I wonder, Molly, if you can give us a little breakdown of how many people at SIH have been vaccinated and where we're sort of looking at that.
Sure. So at this time, we have over 2,100 employees who have received at least one vaccination. And we have over 1,500 who have been fully vaccinated. So of course, our goal would be for every employee to be fully vaccinated, but a realistic goal we've set is more around 70%. So we do know also that some employees have been vaccinated outside of SIH. So what we are asking of those employees is that they would share their vaccination record with OC Health. We want to make sure we have accurate records so we can have an accurate count.
That's helpful. Yeah. So if you think of roughly a third of our organization having the 2 doses, certainly as that increases, so are some of the privileges that come with that, like meeting more in person. Yeah, tricky. Okay, I know the government's goal is 70%, so definitely some room to grow there. Related, you may have heard BJC is mandating that their staff all get vaccinated. So that of course triggers some anxiety for our staff in that we're a partnership with BJC and we certainly respect and often adopt several of their practices and their ours. What is our thought on mandating the vaccine?
Sure, that's a really good question, Carrie. So BJC did recently announce that they will require employees to be fully vaccinated for COVID by September 15th. The reason for doing this is that they believe a fully vaccinated workforce will provide the safest clinical environment possible for patients. So we do continue at SIH to weigh the pros and cons of mandatory vaccinations. At some point, we may require it, but we're not quite there yet. So just be assured that if we make such changes, we will communicate those with plenty of advance notice to all employees.
Yeah, I guess I'm sort of playing with everyone to manage the story in our head. I know that there's a lot of talk and anxiety around like, is it mandated or not, especially when we're roughly at a third of our organization getting both vaccines. So really manage your head talk. There's going to be lots of communication. There are not any decisions around SIH mandating it. Just keep up the good work and the steady, no drama stuff. One more question for you, Molly. You're just a trooper with all these tough questions. What about getting wellness points for vaccinations?
Sure. So we do appreciate when employees offer creative ideas for these wellness points. Unfortunately, we have certain restrictions that apply to incentives that we offer through employer wellness plans. So these restrictions do make it challenging to give wellness points on the basis of a vaccination status.
Yeah, I know that with the flu, there are a few exceptions, medical or otherwise. And if the vaccine was like that for everybody, there's going to be some of those too. So we want to have the wellness points where 100% of people could get access to those points. It's just like we don't give points to get the flu vaccine, right? Because there are the very small portion of true exceptions around that. So makes sense. We don't want to exclude people. We want to include them. Good. All right, one last question for you, Molly. There was a wonder in the question box around employee health and whether or not the hours at employee health could be expanded.
Sure. Thank you, Carrie. So the OC Health Department is currently staffed 7 a.m. to 6 p.m. So if demand increases, they are open to considering expansion of those hours. But currently, they average less than 6 calls per day from all the shifts and only 5 calls on weekends, Saturday and Sunday combined. So we can't justify expanding their hours right now. We do understand that employees may have questions regarding their symptoms. So we would advise that you take a look at the symptoms when you screen daily, and they're posted across all facilities. So take a look at those symptoms, and if you have any of those symptoms, you shouldn't come to work.
Back to that sort of everybody's responsibility to look and read information. I think we got a little spoiled, honestly. Employee health was so available to us in the peak of COVID that we loved them being available to us at our beck and call. But if, gosh, 6 calls a day or 5 over the weekend, I think those were your stats. Yeah, it's just not worth that for employees working. Okay, thank you, Molly, and thank you, Jonna. It is, I know I said this already, but I love having other leaders represent the work that all of us are involved in. That's just super cool. Bart, we're going to go back to you for the standing agenda item, it seems, Harrisburg Medical Center. What's going on? And specifically, people were wondering job opportunities. Like, can I apply for jobs over there? Are they going to take my job? I mean, just all this hubbub around job security.
Thank you, Carrie. Right now, things are going well with our transition with Harrisburg. Our board has approved that Harrisburg Medical Center should become part of SIH. Their board has also voted and approved that as well. We're waiting on a state mandatory timeline of about 14 days to be able to review that, and the state will decide whether or not we can move forward on that. So we think everything's in a line and ready to go. We're probably looking at August 1 would be a date we would bring Harrisburg on. I think everybody needs to understand that it's not like a light switch. And as soon as we pick up Harrisburg Medical Center, it's not like everything automatically turns into everything that we do at SIH. So there's things and processes that we're going to work through. We'll have a group or team from each facility that will sit down and meet, and we'll go through the process of making some of those changes. You know, something as important as, say, Epic and our EMR, you know, that may take 12 to 18 to 24 months to really work through all that. So there are certain things that may change within a week. You know, there's things that within HR that we have to work on policies, and you know, just something as simple as a badge, and how do we work through all those things. So it's going to be an ongoing transition. We're really looking forward to it. I can't wait to have Harrisburg Medical Center part of SIH, and I think it'll be a benefit for the region and for the people who need healthcare. So
yeah. I remember Rex in an earlier session of Town Hall talked about how it's not a purchase. This is really a pooling of talent. And to your part, Bart, to your point, being able to really just serve the bigger community by partnering with them and just sort of aligning all of our resources together. That's awesome. Cool. All right. So I think we've covered most of the big questions. Bart, I wonder if you have words of wisdom that you want to leave us with.
I just want to say thank you to everybody who is working so hard right now. This pandemic has really been tough on everybody. Going back to what we talked about earlier about the vacancy rate, people have stepped up, helped out, worked extra, overtime, filled shifts. All I can say is that I feel very fortunate to be able to work side by side with the team of people that we have here at SIH, from the frontline caregivers to Rex Buddy. This has been a great year to really see what we can do when we're pressured or we're stressed, how we built synergies, how we really improved, I think, relationships across the different hospitals and different service lines. So everybody helped out. And as I said, I just want to say thank you to everybody in the organization for their extra work they provided for us going through this period.
Thanks, Bart. You know, I was in a meeting recently and someone said, I see you. I want everybody to hear what Bart's saying. We thank you and we see you working so hard. So thanks, Bart, for that acknowledgement. As a reminder, we love your feedback. On the hub, there's a survey as well. There's a standing link that comes up so you can ask more questions that we'll tackle next month in SIH Town Hall. Have a wonderful Thursday, everybody.